All right, assalamu alaikum, everyone. My name is Junayed Khan. I'm going to be talking about the topic of foot care on Hajj. And as Naveed said, I'm a podiatrist in Western New York. I currently work at the Chautauqua Center, which is a federally qualified health center. I used to work in Buffalo, New York, in a place called Neighborhood Health Center. So there's a big Muslim population there, refugees from the Middle East, Bangladeshis, and last year actually is when I started seeing patients that were getting ready to go for Hajj or for Umrah, which kind of inspired me to do this talk. And I'm currently working at Brooks Hospital as well in the Department of Foot and Ankle Surgery. Next slide. All right, so just briefly going over the goals and objectives. It kind of just depends on who you are and what you're trying to get out of this. So if you're just a Muslim aspiring to go to Hajj, or if you are going this year, if you're an imam or if you're a scholar, it's a good idea to know some of these statistics I'm going to throw at you in terms of how many miles you're going to be walking, what risk factors actually put someone at risk for injury. And that way, if you have this information, you should be able to help your community prepare for Hajj more adequately and reduce the risk of injury, because that way they'll get more time worshiping and doing their ibadat and not worrying about spending time in the medical tents and things like that. If you're a medical professional or a podiatrist, even if you're not Muslim and you're treating Muslim patients, you should learn the risk factors for the medical and the lower extremity complications that can happen, especially if they're diabetic. And we'll go through some of the studies, and that way you can provide appropriate medical and lifestyle recommendations. Now, if you're a Muslim and you're a physician, then you should know all of this information, because guess what? You're going to be the doctor in the family. You're Muslim, and your family and friends are going to be asking you, "Hey, what can I do to prepare for Hajj?" So it's important to know this stuff. Next slide. So just a brief background, just in case there are, some non-Muslims, that are tuning in here and that will be treating Muslim patients. So Hajj in Arabic literally means pilgrimage. These statistics are from 2018. So again, this is pre-pandemic, giant expansion of the construction, but about 2 to 3 million Muslims perform Hajj per year. And obviously this happens once a year in Mecca. And this is a requirement for every Muslim at least once in their lifetime. So just looking at this picture here on the right side, if you look at this Hajj guide, so you have to enter in the state of Ihram, you have to make Dawah, you have to do Sa'i between Safa and Marwa, and this is all indoors nowadays, alhamdulillah for all of us. You have to stay in Mina. From there, you're going to Mount Arafah. You're spending a night in Muzdalifah. You're going to do the Jamarat. You're going to sacrifice an animal, shave, trim your hair, and then go back to Makkah. And we'll go through kind of, what each ritual partakes, how many miles you're walking, things like that in the next few slides. But this is just kind of a brief recap of what the Hajj is. And if you're doing an Umrah, which is a lesser pilgrimage, you stop basically at number 3. You're not doing anything really beyond the Sa'i in terms of rituals. So Hajj itself is a series of rituals performed over a 5 to 7 day span on foot. So obviously, if you're medically capable, on average, people are walking about 3 to 9 miles per day. And Naveed, I don't know about you, but I don't walk 3 to 9 miles a day right now. I just checked my app just for fun, and my average over the last year was about 1.5 miles a day, right? And over this 5 to 7 day span, you're walking about 40 miles. And that's a significant amount of mileage that you're walking, right? Especially for if you think about people who are elderly that are just kind of getting off their couch and going for Hajj, that's, obviously that's a disaster waiting to happen. And, just again, a note about Umrah, it's voluntary, it can be done any time of year, and it involves less rituals. Next slide. Thank you, Yusuf. So this is a satellite kind of pictorial of all the ritual sites that you would be going to as a pilgrim. So the Grand Mosque in Mecca is where we're starting at. You're entering in the state of Ihram. You're going to be making Tawaf and Sa'i. You're going to be going to Mina, as we mentioned. I'm not going to repeat everything, but you can see the mileage between this. And my understanding is you're not walking, between all these places. There are shuttle buses and things like that. And anyone that's already been to Hajj will tell you that people do get lost, right? People do end up with heat strokes. People do end up dying, unfortunately, right? Getting lost, missing their shuttle and things like that. So So, guess what? If you're in Arafat and you're supposed to be going to Muzdalifah, well, that's about 6 miles away. So, just kind of keep these things in mind. People go in tour groups and things like that, but there is a possibility that people get lost. And this is just kind of highlighting, kind of how far apart all of this is. Next slide. So now getting into the actual rituals themselves. So you start making tawaf. So tawaf is the circumambulation around the Kaaba 7 times. And as we all know, the closer you get to the center, the more crowded, the more pressing, and potentially the more injuries you actually see. So a lot of people prefer to walk further out. And as you walk further out, obviously you're walking more miles. That's why you have a range of about 1 to 3 miles of walking. I'll just tell you from my own experience. I mean, if you are bringing a parent that's going to be in a wheelchair, for example, you're walking way more than that. You're walking way more than 3 miles. So last October, 2 Octobers ago, I took my father, who's elderly, via wheelchair to make tawaf for Umrah. I just did, tawaf and sa'i, and I walked 10 miles just doing that. So just these statistics are for someone on the ground, on the haram, by the Kaaba, and doing circumambulation. If you're with a loved one that's in a wheelchair, expect to do, gosh, I don't know, 2 to 3 times that. So that's just for the tawaf. Next slide. And this is the sa'i. And so you have, Safa and Marwa, historically, a long time ago, this was done outside. And between Safa and Marwa, you have 2 green slopes. Between the green slopes, you're I don't want to say running, but you're kind of marching. Your feet are you're going at a very brisk walk, I'd say, or running, you could say. And in total, this is about 1 to 7 miles as well. There is a wheelchair portion of this as well if you do need to take a loved one, but the distance is honestly about the same. Next slide. And then we have the Jamarat. So you're doing 3 round trips from Minna to Jamarat, and the total over about a couple days, 3 days or so is about 20 miles. And this varies too. I mean, if you have the VIP diamond package and you're right in the front here, right, with the tents all the way in the front here, it could be less than that. But look how far back Mina goes. I mean, those white tents are going back as far back as the eye can see, right? And you'd like to think that maybe there is a shuttle bus, but maybe there isn't. Maybe you're walking up to the Jamarat Bridge. So this is 20 miles. This is about an average. There are people doing probably much more than that over 3 days. Next slide. All right, so now we're going to get into some of the footwear, questions, concerns, fiqh type of issues that everyone is always very interested in. So there's confusion that exists around footwear during the pilgrimage. Muslims typically cannot wear shoes or sandals inside any masjid. Several rituals during the pilgrimage are actually performed within Masjid Haram in Mecca, correct? So naturally, people feel very weird wearing shoes and sandals inside the masjid. I mean, I went to Umrah in 2014. I knew that I could wear sandals, but even then I just felt uncomfortable. People were staring at me. They're like, why are you wearing sandals? This is the holy mosque. I don't know. I felt pressured to take off my sandals, right? But, according to the Musnad of Ahmed, 8500, it's recommended to wear sandals during the pilgrimage, even within, Masjid al-Haram. There are, certain conditions to this though, especially if you're a male. So females can wear socks with closed-toed shoes. They can wear open-toed shoes. They can wear sandals. And we'll get into why this is such a rahmah. This is such a blessing that females can do this. And I'll revisit this a little bit later. Males, there are differing opinions on this, and we'll get into this a little bit more in the next slide. But I'd say the majority opinion is that the medial and lateral malleoli, which are the ankle bones, which I'll show you in the next slide, they have to be uncovered. And the upper and middle portion, which are technically the tarsal bones of the foot, have to be uncovered. So the tarsal bones are your calcaneus, your talus, your navicular, your cuboid, and your cuneiform. These have to be uncovered. So generally a safe bet is something like pictured like this, like a sandal, for example, right? So this is just kind of covering maybe the heads of the metatarsals, maybe half of the metatarsals, right? That's probably coming like up to here, right? Just going, The one little strap here between the toes is kind of coming right here. Sorry, you guys can't see my mouse, I realized. But next slide. So let's talk about this a little bit, Naveed. So, these are kind of the conditions. Females can wear, basically whatever they want. Males, medial mater malleoli, which are these white ankle bones you can see here, have to be uncovered, and these tarsal bones have to be they have to be uncovered. So let's look at 1 through 4. Naveed, so let's discuss. I mean, we can share the spotlight with you as well, or are you not able to do that because you're sharing?
No, so I can do spotlight on both of us, inshallah.
All right, let's do it.
Okay. All right, so yeah, it's on to both of us.
All right, so I mean, Naveed, looking at number 1, what do you think? I mean, would you be okay with this? I mean, wearing this to Hajj, or would you not?
So number one, it fits well, when I say number one, I mean, the first sandal here, right? It fits all the requirements. So it's not covering the ankle, it's below the ankle. It's not necessarily covering the entire foot. The strap is very functional, meaning you need to have the strap or else it'll fall off, right? The sole of the sandal pretty much matches, the size of someone's heel. So with number one, no scholar, from my knowledge, would object to it, right? That's precisely the sandal that it checks off all the boxes, right? It's below the ankle, doesn't really cover the foot. That's like the safest bet, right? If you want to be 100% safe, if you don't have any like medical issues or whatever, right? And you're trying to do the safest thing possible, one is your best bet.
Okay. Yeah, I mean, speaking from a medical standpoint, I absolutely agree. Like I mentioned with that last flip flop, I mean, this is going, just kind of right at the toes, right in the front, and then it's probably going through the midfoot. So if you see the white bones, the little picture on the right here, the white bones, it's probably going maybe midway through that. So there's no risk of this really covering any of the tarsal bones or your malleoli, your ankle. It's not covering any of that. So this is, I agree, 100% safest bet. What about number 2? What do you think?
So 2 and 3, this gets into a bit of a gray area. The majority would have a problem with the straps here because, I mean, at this point, it's not completely functional, right? At this point, you could just have a single strap like the first one here to make sure it stays on your foot. But here, I guess the strap is for a better grip or whatnot. On top of that, depending on the size, I mean, depending on your foot, right? You might end up covering like half of your ankle, and you might end up covering a good portion of your foot actually. So 2 and 3, 3 even more actually. And this is almost going to guarantee cover your ankle, right?
Mm-hmm.
The majority of scholars would have a problem with this. The majority would say this is violating the condition of the sandal being below the ankle. I mean, the Prophet ﷺ, he gave back in the day, right, when people couldn't really just go to a store and buy some sandals, right? The Prophet ﷺ did give a concession for those who couldn't afford sandals, and that's taking a leather sock, right, or hoof, and basically slicing it below the ankle, so then it becomes like a sandal, right? Um, because of that, some of the scholars take that hadith and say, as long as it's below the ankle, you can still wear it, even if it's like covering a good portion of your foot. Even some go as far as saying, even if it's covering some of your toes, right? But again, it's a bit of a minority opinion, right? Some of the Hanafi scholars say this. Ibn Taymiyyah, rahimahullah, he says this. If I'm not mistaken, Ibn Baz, rahimahullah, he says this. But then again, that's a small group, right? And even the ulama that say they have a stronger case from a fiqh perspective, still this is Hajj. Like, do you really want to take chances at Hajj? Like, bro, it's a once in a lifetime journey. You spend thousands of dollars. You really want to take that chance? So they'll still say go with number one because you just don't want to be in a gray area, especially during Hajj, right? Come on, like that's the one time, right? You don't want to be in a gray area with your practice of Islam, right? So 2 and 3, majority would say no, it violates the conditions. There is a minority group of scholars that would say that 2 and 3 is fine as long as it's below the ankle, right? But safe bet is still number one for sure.
Okay. Yeah, I mean, just looking at the sandal and kind of what bones it would cover and whatnot. Number 2 and 3, if it's just that kind of front thin strap, just again, it's probably going to cover maybe part of your midfoot. But the straps that kind of go in the hind foot or around the ankle, yeah, I mean, it's going to cover some of these tarsal bones altogether, right? Some of these straps may even cover the ankle bone, as Naveed said, your lateral medial malleoli. And absolutely agree, man. This is Hajj. Like, if this is a gray area, just kind of err on the side of caution if you can. But yeah, so 2 and 3 are where people kind of really get confused. What do you think about number 4?
So number 4, I mean, you're covering, it's really the same answer, right? The majority would say no. There is a smaller group of scholars that would say it's okay because if you notice, your ankle will be uncovered, right? But then again, like a good portion of your foot is going to be covered, even though your toes will be free, right? But your ankle will be free. It's kind of the same answer, really. It's kind of the same answer. Honestly, like, this really goes back to, it's no longer an issue of fiqh, right? I mean, the fiqh's in the books, it's there, right? You will always find a scholar that would say whichever sandal you want, you can go fatwa shopping, right? But it's really about your personal ethic with Allah, right? Your personal relationship with Allah. Do you really want to play games here, right? Do you really want to choose a easier opinion here, right? Just for comfort's sake. Now, obviously, I think we're going to get into this, right? Where if you have a legitimate medical concern, right, there is kind of a process you have to take if you take a concession. But we'll get to that when we get to it, inshallah. But yeah, 4 is the same as 2 and 3. In fact, 4 might even be a little bit more sketchy because I mean you're covering like 60% of your or 50% of your foot at least, right?
Right. Yeah. I mean, what I will say about slides, and I know Brother Yusuf just mentioned that the ones they sell look like this. Um, if it is a slide, again, as long as it's not going that far back on your foot, if it's just like maybe half of that strap, if it's just half of that strap, then maybe it's just kind of covering your midfoot here and it's leaving your tarsal bones, which are these colored bones in this picture. Your tarsal bones are these colored pictures, these colored bones. So if it's just kind of covering like half of your midfoot, if it's kind of in this white area, you're good, right? But this slide is just way too much. So there are slides that I'd say might work, right? So I don't want to like say no slides, right? It kind of just depends on how thick that like overhanging strap, not strap, whatever the heck is called, the upper. I mean, it depends on how big the upper is. So I think a few brothers asked a few questions about specific sandals. Inshallah, if we have time, we'll kind of go back and talk about it a little bit more.
I do
We can
want
go
to
to the next slide.
mention
Yeah.
before we move on. So, it's not a one size fits all type of answer here, right? Now, obviously, there could be a sandal that looks like 2 or 3 or 4, but for your specific foot type, it actually might work.
Right.
Just like I guess where your ankle is, right, and how big your foot is, and also all these factors, right? So don't take this as a a fatwa or like a one size fits all. Like it has to look like this, right? We're trying to give you the guidelines so for you to determine yourself, right? Like I said, if you can find something that looks something like number 1, you like there's no one who's gonna raise an eyebrow, right? But 2 gets a little 3 even more so because you might end up covering your ankle depending on your ankle, and 4, like, okay, you covered a lot of your foot already, right? So just keep that criteria in mind, not necessarily the exact styles, right, that you see here.
Right. Agreed. All right. We go to the next slide whenever. Okay, so a common question that I've been asked by a few people are, what if I have painful feet? What if I have painful feet, right? Am I allowed to wear different sandals? So, can males wear sandals or shoes that don't meet criteria for due to medical reasons? Any insight on that?
So if there's a legitimate medical reason, and obviously, with the caveat that your podiatrist has told you that okay, you have a real medical excuse, right? Not just my feet hurt type of thing, right? You are allowed to then break this rule and wear something that will cause the least amount of damage or pain to you. However, you have to give a fine called a fidya, which basically you're not sinful, but you have to pay this fine of a fidya. And the fidya is either you fast for 3 days or you slaughter a sheep and you distribute the meat to the poor around the haram. And you can choose whichever one. Yes, so you're not going to be sinful if you have a legitimate excuse, but you do owe the fidya. You have to give that. Now, if you don't really have a medical excuse, it's more of like a comfort thing, and you just don't want a sore foot at the end of Hajj, that's you will be sinful then. Because Hajj again is not a vacation, right? Hajj is a hardship, and your feet are gonna hurt, right? You can't take this concession lightly. It's if you legitimately have a real, a medical issue. Your podiatrist has told you that you have a serious medical condition, then you take this, right? The only other scenario where someone might not be sinful is if somehow they didn't know the fiqh ruling of this, right? Which I think in our times doesn't really apply. It's as simple as a Google search, right? How to wear haram. So yeah, either you have excuse, you're not sinful, don't worry, you're fine, just pay the fidya, or if you're kind of like lying to yourself and kind of trying to beat around the bush, then that person is sinful, unfortunately.
Yeah, and great answer. And this kind of leads into the next question. Is it better to just pay the fidya and just wear the shoes that make you comfortable, not have that severe pain, or is it better to try anyway? And if you're at that point where you can't walk anymore, you just kind of use a wheelchair. I mean, I know this is kind of like a weird question, but I've been asked this before. I mean, any insight on that one, or?
Yeah, I mean, again, no one size fits all here, right? I think it depends on, so in this case, we will need a podiatrist to tell us how severe is the condition, right? If it's something that will end up causing an infection and end up causing the person to, lose their foot down the line, that's pretty severe. They should definitely take the
Right.
concession, right? If there is a concession, it should be taken. Uh, Going on a wheelchair, especially if it's a younger person, um, I really would say this is the podiatrist call here, right? Is it really that do they really, really like need a wheelchair? I would always side on, I always side on, caution, like just always try to not take concessions, right? If you really don't need it. But if you do need it, then by all means, I would say take the fidya, unless your podiatrist really tells you, listen, you're gonna like lose your feet if you do this walking, right? That I guess I'm gonna throw the ball back into your court, into the podiatrist court. The fiqh is clear, but then the nuances, the podiatrist has to figure that part out.
Right. Yeah, absolutely. And again, like, we haven't even gotten into the studies yet, but the role of the foot specialist is like so important, before someone's planning on going on Hajj. It's like super important. But yeah, I mean, I would say, for the podiatry people that are in here, if someone is at risk for diabetic foot, ulcerations, Charcot foot, if someone is at risk for a stress fracture, right, they probably shouldn't risk it, right? So, but I'd say in the majority of cases, I mean, especially a younger person, I don't think they really need to be using a wheelchair. Um, and, just last point is not really a question, but, always just ask a trusted imam or scholar if you intend on utilizing footwear that does not meet criteria for ihram, right? Just don't just Google it and be like, oh, yeah, Islam QA said this, I'm good, right? So just, have a conversation about it because again, it's Hajj. You don't want to really take chances on this, right? So next slide.
And just one last point I will make is, so a SAR, again, it's not necessarily a measurement. Someone commented in the comments, I know SAR is a handful, right? But the ulama have, especially for modern day times, right? They've kind of conceptualized it a little bit better. So inshallah, if I can find something, for modern day time, like what do you mean by SAR? Like, do I just put my hand in a bag of rice and go find a poor person, right? Like, how does it work exactly? That, inshallah, I can get you the exact details. I'll email that to you, and then you can email it out, inshallah.
So,
All right.
and this is just so before you press play, Naveed, I was just very happy to see this because this is the Ministry of Hajj and Umrah in Saudi Arabia. They actually posted this on their Twitter a couple years ago. If you just want to press play, it just made me happy. So these are guys walking barefoot at Arafat, and you see there's a nope, don't be doing that. You should be wearing sandals. Yeah, so there is more awareness to this. I mean, I don't know if anyone's going to Hajj through a package. I mean, actually, you have to. Oftentimes, the travel agencies, or well, I don't know. I don't know the process. I don't know if it's through travel agencies anymore. But travel agencies used to send you a packet of things to prepare, and I've seen more and more of them now saying like, these are what shoes you can wear. Don't walk barefoot. So I'd say, from an educational standpoint, there's much better awareness for this issue. Don't be walking barefoot. So, next slide. So this is a really interesting study, and Naveed, I kind of want to know your your opinion about why they may have said this. So this study was done by the Diabetic Foot Care Research Team in Hajj. Um, Foot injuries among Hajj pilgrims with and without diabetes mellitus, implications for infection. It seems like a great article, but when I read the abstract, I decided not to include the data because I was just annoyed by the second line in the abstract here. So it said, pilgrims, paraphrasing, are required to make circuits barefooted, again, required to make circuits barefooted on scorching marbles around the Holy Mosque in March between hillocks for hours. Okay, so if everyone making, Hajj and Umrah were doing this, we would have way more foot complications and burns and things like that. But Naveed, why do you think that they mention this? Are there opinions out there that say you have to walk barefoot? And I don't know, have you ever felt the marble to be scorching hot? I mean, I haven't, but
I mean, from what I know, they have like massive air conditioners and all this stuff. I went to Umrah back in August, like peak heat season, and the marble was like so cold. Like, to be honest, I'm very comfortable. So okay, now this is one of those things where you see firsthand how, unfortunately, at times the Western Academy really, you see Islamophobia within academics, right, within the academy itself. Now you may say, oh, but Naveed, there's like a bunch of Muslim names here. Doesn't really matter, right? You look at the abstract and just the language. This looks like a Fox News kind of thing. This does not look like an academic article to me, right? To be very honest. For those, I mean, I didn't really introduce myself. I actually am doing a master's degree in Islamic sciences at academic institute. So this is stuff I deal with all day, by the way. Academics, I guess, slowly sneaking in Islamophobia, right? Within their work. The Prophet ﷺ himself wore a sandal, right, during ihram. It's more of an ethics thing where some ulama would say, if your sandals are dirty, you might want to take them off just to not dirty the masjid, right? Because now, obviously, during the Prophet ﷺ time, they didn't have this beautiful, magnificent, white, marble structured masjid, right? So they had to keep the sandals on. Now, some ulama just say, not really out of fiqh, but out of ethics, right? Just out of adab, out of ethics, like, maybe you should take your sandals off, especially if they're dirty, right? You don't want to dirty up the masjid. That's just wrong. You don't want to do that, right? So it's more of a, some ulama would say take off your sandals while you're making tawaf, right? Just so you don't dirty up the masjid, right? And you will notice a lot of people, that's what they do, right? And it's more of an ethics thing than a legally like something that Sharia requires you to do for your Umrah and your Hajj to be accepted, right? In fact, when I went to Umrah back in August of last year, I was with somebody who is doing his master's in fiqh right now in Islamic University in Mecca, and I was about to take off my sandals, and he's like, "Keep it on." right? And I was a little shocked. I was like, oh, okay, that's interesting. I feel like the sore thumb in the whole crowd because everyone else doesn't have anything on. But that's actually the sunnah. Um, and as long as you're clean, as long as your sandals are clean. Now, if you're coming from like a bathroom, and you know how the bathrooms in Saudi are, it's those squatter things, right? And you might have like urine or something on your sandals, for sure you should take them off, right? Or if your sandals are just filthy or something, yeah, you should take them off out of adab for the masjid and to not make the cleaners' lives miserable, right? Not the Sharia requires you to do this. And on the scorching marbles, as they mentioned in this paper, which I have never, in fact, I think somebody in the chat just said, I don't know anyone who's ever felt the scorching hot marbles that they're talking about here. It's usually very cool, very comfy. But yes, there's no from a fiqh perspective, there's nothing you can wear your sandals during your entire ihram. I mean, that's what the Prophet ﷺ did, right? He wore sandals. There's nothing saying that you have to be barefoot. It's more of just a ethics thing where you don't want to dirty up the masjid. Your sandals might be dirty, and that's about it.
Right. And I just want you guys to know, like, there are multiple articles out there that say this kind of thing. Like, we'll talk about like foot pain and what's going on in Hajj and Umrah, and it'll say like, oh yeah, the pilgrims are required to walk barefoot. It's like, no, it's this misinformation that's literally perpetuating people to have these foot injuries that I'm going to be talking about because they think you have to walk barefoot, right? So it's really unfortunate. But so you can go to the next slide. I just want to talk about the tile for a second. So the Thassos marble is actually what keeps the floor cool. I know there's some, like, I don't know, urban legends or something that Zamzam water runs underneath the marble and that's why it stays cool. Like, that's not true from my understanding. I mean, look, they looked it up and they replace it every now and then. It's a specific type of marble, I believe, that comes from Greece or something like that, that reflects light, reflects heat, so it stays very cool, basically, right? I think the floor in Medina can get pretty warm in the sunlight. I don't know if they're getting confused with that, but it's definitely it's not warm, right? I've never heard anyone say that. And again, you're not really going to see a lot of burns if you have to do tawaf in scorching hot marbles. Like, you're going to see burns, and you don't really see that as a main complication. What I'm going to talk about in the next kind of half of this presentation here. All right, so now getting into some of the more academic, medical literature. So this is a study by El-Shiri in 2021. The article is titled "The Prevalence and Factors Associated with Musculoskeletal Pain Among Pilgrims During Hajj." So this was a cross-sectional survey. So this means they didn't follow people over time. They're just looking at people in one moment, one time, 1,715 pilgrims. The key thing about the methods of this, and it's really important to see how a study was designed. So it was not performed in medical tents. So they just kind of asked random people, right? Just the general population. Because obviously, if you ask people in medical tents, there's going to be a bias, right? They're obviously going to have some type of issue. So just general population, they looked at adults, 18 and older. They looked at some of these statistical measures. So they found that about 13.76% of people experience falls. All right, that's pretty high, right? If you really think about it. I mean, and obviously, if you fall, you're going to have musculoskeletal pain. So these people were excluded from the study altogether because they fell. They're going to have pain, right? So older patients, meaning if you're 50 or older, and if you're female, you're more likely to experience falls. So this is very important, for anyone who's non-medical. Older patients, 50 plus, and females more likely to experience falls, right? And as we know, falls can be very serious, right? There's some old literature about hip fractures, for example. You fall, you have a hip fracture. The risk of you dying, well, according to the one study, the risk of you dying in 5 years after a hip fracture is 50%. That's significant, okay? So falls is very bad. So they looked at 1,479 patients that were included in this. And of the people that they looked at, 80% of them experienced pain. That's just about everyone, right? So if you go to Hajj, it's going to be normal to expect some pain. Overall, the pain was more common in females. Again, recurring theme. And the most common site where people experience pain was the lower extremity. And you're going to see this as a recurring pattern throughout many different studies, right? I didn't purposely choose the studies that focus on the lower extremity. I just chose general studies, prevalence and risk factors, right? And it's always these same risk factors: females, over 60, obese. So again, remember how I mentioned earlier that, you know, it's such a rahmah, it's such a mercy that Allah SWT allows females to wear socks and shoes and protective footwear, because literally they are at risk for trauma, for pain, for all of this stuff, right? And 60 plus, I mean, anyone that's been to Hajj and Umrah knows that a lot of the people there are actually over the age of 60. Next slide. So this is more of just a graphical representation of where people complained of pain. Again, they looked at 1,479. These are people that did not fall, okay? And these are people that are not in the medical tent, just general survey. So 65% of these people experience pain in the lower limb. That's, for anyone, any podiatry people here, medical people here, that's over half of the people are gonna have pain in the lower limb. Specifically in the lower extremity, people, about 38% of people experience foot and ankle pain. If you do the numbers here, basically, if you include the knee, 90% of pilgrims experience some type of pain. That's 1,332. 90% of people have pain at the knee or below, right? So that's just about everyone, right? So again, this is just extremely relevant for any of the lower extremity specialists in here. Like, you have to know about this, right? You have to know about this for your friends, for your family, for your patients. You have to know about this. Next slide. Again, this is just a statistical table for anyone in here that kind of likes seeing the p-values and statistical significance. So this was statistically significant over the age of 60 and BMI over 30, which is technically obese. These were statistically correlated with musculoskeletal pain on Hajj. Next slide. So this is a study done in 2015. This looked at foot ailments during Hajj. This was a cohort of 129 pilgrims, so prospectively, which means they didn't look back at people, or they didn't look at people at a point in time. They followed these 129 people and kind of see what happened to them. That's what a cohort of a prospectively study means. And they were accompanied by a medical doctor and an investigator who were documenting it. And female to male ratio was about 1-to-1. The mean age was about 62. So again, most of these people are already over the age of 60. In this study specifically, they looked at diabetics and non-diabetics. They found about 31% of the people experienced blisters during the questionnaire after Hajj. And prevalence of complications: females, overweight, and obese. So overweight is technically a BMI of 25. So that's a little bit of a nuance compared to the last study. But again, I just, for a second here, you know, if we just think about it, most of the people over the age of 50 or 60, you know, typically they've slowed down, especially if you look at our culture, right? South Asian, Arab culture, whatever the case. Oftentimes it's, you know, the females, the mothers, the grandmothers, they're not super active, you know what I mean? For one reason. And it's the same for males. So just inherently we're at more risk for these types of pains. And just a note about diabetics, they didn't find diabetics to be at greater risk than non-diabetics, but this is a very small sample size. I don't think you can make a definitive conclusion based off of how this study was set up. So next slide. So this was specifically a study looking at acute complications of diabetics among pilgrims. And this was again, a cross-sectional, meaning they're looking at people in one point in time. And these people were in medical clinics in Mina. So these were not the general population. More males to females in this one. Of you know, the 281 people they looked at, 70% of them had foot injuries, right? And I promise I'm not like, you know, pushing an agenda like, okay, you guys have to see a podiatrist before Hajj. Like, no, like people are getting foot injuries, diabetics, non-diabetics. 27% of the diabetics had hyperglycemia, so their blood sugar was too high, and 13% of them, it got too low. The most common presenting injury when they had a foot injury was just redness, bullous, or blisters forming. And this is a really important point for the medical people in here that are not podiatrists. So non-compliance was statistically correlated with complications in diabetics. So most of these pilgrims that didn't have acute complications had insufficient diabetic control. They didn't see the camp physician. So for those of you that don't know, there is a camp physician. If you're sick, if you have a fever, whatever the case, there is usually some type of physician that's on site. At Mina or wherever you are, there's usually someone there with you. Of course, Mina and Arafat have their own hospitals as well. So 65% of these diabetics weren't actually seeing a doctor. 52% of them didn't see their doctor or podiatrist before going to Hajj. Okay. And 70% of them didn't even bring any type of method to track their blood sugar, right? So it's not just that they're getting foot injuries, it's that it's the non-compliant patients that are actually getting the complications as well. So, for any of the primary care doctors, family medical doctors here, you have to have a long discussion with your patient, your Muslim patient about, make sure you take your glucometer, make sure you see the camp physician, make sure your sugar is under control. That's just, I can't stress that enough. And for the podiatry people in here, we have to talk about footwear, prevention, things like that, which we'll get into in the next slide. Next slide. And this is a very recent study. It was just published a couple months ago, actually. This was specifically looking at traumas and injuries during Hajj. And, the year was 2022, but it's published in 2023. Again, cross-sectional study. They were looking at Mina and Arafat. The most common type of trauma they found was cutting wounds, so cuts, right? And the most common causes were falls and foot twisting, all right? So once again, the lower extremity was the most common site for trauma during Hajj. So 73% of all injuries occurred in the lower extremity. And again, by lower extremity, I don't just mean the foot or the ankle. I mean, hip, knee, the whole thing, leg, so your whole lower limb, basically. But in the lower extremity, the most common site was the foot. The 55% of all injuries did occur in the foot. It was the most common traumatic site of all the injuries. Next slide. And these are just some interesting facts that I felt, well, the authors felt, they should mention. They actually did a demographics screening as well here. And they found that Egyptians were statistically significantly more likely to walk barefoot. And Saudi nationals were more likely to twist their foot, to have an ankle sprain. Why that is, I have no idea. For the Saudi nationality thing, it could be that maybe they've done Umrah a few times, maybe they're more familiar with it, and I don't know, maybe they're just a little bit more comfortable, and maybe they just kind of missed a step here and there. I'm not sure. And why the Egyptian nationals were more likely to walk barefoot, I'm not sure. If there's anyone here that is Egyptian that maybe has some type of information about that, it'd be good to know. These authors were also perplexed as well. And this is not really a surprise to anyone that's been to Arafat, but foot twisting and ankle sprains were more significantly higher at Arafat. It's sloped, there's stairs, it's not perfect, there's like missing steps. More attention has to be paid to the pilgrims. Again, for any of the group leaders here or the imams, community leaders here, you have to keep an eye on people at Arafat. I mean, it's crowded, the steps are not even, it's, people are going up the rocks on the side. You're just more like, just bad things just happen here, right? So next slide. Again, this is just a kind of a graphical presentation for the people that are kind of want to see the p-values and things like that. But yeah, foot twisting and ankle sprains are twice as more likely to occur in Arafat if you look at it that way compared to Mina. And pressing and overcrowding is a big one too. Not only can people, step on your foot, but they can knock you on the ground. That's oftentimes how falls happen. I'm sure you guys all remember, a couple Hajj seasons, people fell down and got stampeded and were killed, right? So this is also a big issue as well. Next slide. And again, just kind of pictorial representation here of where the injuries are happening in the body. So lower limb, 73% of everyone, of that 55% is in the foot. And you can see in Arafat and Mina, it's actually about the same here. Next slide. All right, so now to kind of bring things home here, just what are the safety recommendations that the people in medicine, the community leaders should know to talk to their Hajj groups about, to talk to your family about? You have to wear well-fitting shoes that are already broken in. I want to say about 8 out of every 10 people I talk to who's going to Hajj or Umrah, they're like, I want to buy a new pair of shoes. I get it. You don't want to come to Makkah, or you don't want to walk around Medina with old dirty shoes. I get that, right? Clean your old shoes that fit, that you're comfortable in, and wear those shoes or sandals, whatever you have. If you wear shoes that are not broken in, you're just going to have trouble. You're going to have trouble because, it's going to be too tight on the arch or in the heel. You're going to get blisters. And if a shoe is too small, you're going to get, cramping of your toes. You're going to get pressure sores. You're going to get some issues from your toes sitting like that for 40 miles, right? If they're too large, your feet are kind of just going to slide. They're kind of going to slide. You're going to have more rubbing, more friction blisters. And if you're a sister or a brother that has the medical necessity, if you can wear a shoe, wear something that gives you good shock absorption or soft padding in the heels and the balls of your foot, right? That's, if you think about the gait cycle, right? I'm not going to go through it. That's kind of where a lot of your pressure typically is offloaded, right? Ball of your foot, your heels. And this is also very much dependent on foot type, right? For people that have flat feet that you can maybe use some arch support, wear a shoe that gives you arch support, right? If you have really high arch feet, wear something that just has a good accommodative or, cushioned feel to it. Women only, if you can wear socks. I know it's like, 100 degrees, usually it's dry heat, but if you can wear socks, it'll reduce the impact on your feet. It's just another layer of cushion that you can wear, and wear supportive sneakers if needed. And this is an important one too, just a good moisturizing cream, 2 to 3 times a day, right? Just put it on your feet. It's going to reduce any friction. It's going to reduce, the cuts that happen. That's the most common trauma that happens on Hajj. And ideally, it should be unscented, because while you're in the state of Ihram, my understanding is you're not supposed to beautify your body or use perfume and things like that. So again, you don't want to risk it. Just use a good moisturizing cream that's unscented. Next slide. And the reason why I have the, I'm sure you guys are wondering why there's a picture of people running a marathon here. But that's what a Hajj essentially is. I don't know if anyone here is a runner, but you have to train for it. You have to just lead up to it, right? You cannot just get off your couch and walk 40 miles in a week. That's not going to end well. So start going outside more. Start walking, your 2 or 3 miles a day. Don't just get up and go. You have to slowly ramp up that activity and try to lose some weight. If your BMI is above 30, you're probably going to have pain, right? According to these studies, there's a 70 to 90% chance you're going to have pain if you're overweight, or specifically if you're obese. Talk to a nutritionist, right? Talk to a podiatrist. Talk to your family medical doctor. There are some amazing medicines out there. I'm not going to say any names or anything, that will help you lose some weight, especially if you're diabetic. That's all going to help you have a more meaningful Hajj experience, so you're not worried about your foot pain, that you're not in the medical tent, that you're actually focused on your worship. And of course, I cannot stress this enough. If you took nothing else, from this presentation, just take this. You should seek medical podiatric consultation before, during, if needed, and after Hajj. Especially diabetic patients, you have to make sure that blood sugar is controlled and you have a way of monitoring and tracking it. Next slide. And these are the references. If anyone wants to talk about where any of these numbers or statistics came from, I'd be happy to share it with you. And then next slide. And that's pretty much it. So just kind of a reminder of who we are, what we do. So Naveed is with Western New York Dawah. I'm from the Muslim Podiatry Network. I'm one of the co-founders. We're focusing on education of our community, of our pilgrims, of our ummah, mentorship, advocacy, service. We're always willing to talk to you guys about anything you guys want to talk about, related to the foot, to our deen, to anything like that. Any questions, you can just shoot us an email at muslimpodiatrynetwork@gmail.com. Any questions? Or Naveed, do you want to add anything before we open it up for questions? I think there were a few questions in the chat box here.
Yeah, I think I would just add, it's this is really great work, Junayed, that you're doing. I think, unfortunately, there's always, I find this divide, right, or this kind of invisible barrier between sometimes, like medical professionals or, people in medicine versus, I guess, the Islamic side of things, or like the Islamic scholarship. And, I would just say that, fiqh or Islamic law, and sorry if I use Arabic terms that you don't understand, just let me know. But for the audience, Islamic law, look, it's not as complicated as people make it, but it's also not as like do it your DIY as people make it either, right? It's very important to have conversations with people who have a deep understanding, obviously scholars, who might even be medical professionals themselves, all right, or really understand the situation. If you're just gonna like search Google, like, oh, is it like haram for me to do this or whatever, right? Or is like halal for me to do this, right? You're gonna get like, or you're gonna go on Reddit. You're really playing with fire, right? Don't do that. At the same time, right? If there's like a local imam or sheikh who like everything and anything is haram to him, he doesn't have a deep understanding, right? He clearly does not have a deep understanding, right? Try to seek out people who have, a proper understanding and a deep understanding of Islamic law, as well as a proper understanding of your circumstances, right? If you are a podiatrist, right? Try to connect, for your Muslim patients, try to connect to a Islamic scholar in your area. Trust me, there's plenty. And if not, there's entire associations like the American Muslim Jurisprudence Association, or MJA for short. It's a board of Islamic scholars. Of them are scholars who are also physicians on the side, right? Contact them if you have a very specific scenario. Like Junayed shared with me, somebody asked him, someone who has flat feet asked him, if I should just take the concession or should I just do a wheelchair? Now that's a very, even, for a podiatrist, right? You don't want to be playing with fire here, right? You want to have somebody who has a deep understanding of the law, and who gets your situation to give you a custom-made fatwa. That's what a fatwa is, right? A fatwa is a custom designed answer for your custom situation that's not like in the textbooks, right? So, grow your network to have Islamic scholars, right? And at the same time, Hajj is a season where Muslims from all over the world come together, and Muslims with, one of the beauties of Islamic law is that it's very rich and very diverse and it's very adaptable to different cultures, times, and places. So you have people who will swear to you that you cannot wear sandals, right, during Dawah, right? There's people like that, right? Or there will be people who would just do things very differently. Just learn to appreciate these differences, but be well grounded in the decisions you make or the decisions you make for your patients if you are a practicing podiatrist or a physician. And the side thing is really bothering me. So I do want to just clarify that, right? So I did some research, and some ulama say, so okay, here's how it works, right? A sa'a is basically if I take both of my hands, right, and pick up like rice or dates or something in my palms, that's called one med. Okay. A sa'a is 4 meds. So a sa'a is like 4 handful of something, right? Dates, wheat, rice, whatever it might be, right? So with that, scholars differ, right? You can't really put a measurement to it, as somebody mentioned in the chat. But then, organizations, relief organizations, they put a price to it usually. So when Eid comes around and you give fitr, zakat al-fitr, Islamic Relief will have a certain amount. Another relief organization may have a certain amount. Your local masjid may have like $1 off difference. That's all because we're trying to figure out, in modern day times, right, these exact measurements of what did the Prophet ﷺ mean, right? So there's gonna be, situations like that. So I do want to clarify, the Prophet ﷺ said you have to give half a sa'a to 6 people. Okay, so if you're going to take a concession, your podiatrist told you have a medical excuse, you take a concession, you wear sandals or shoes, right? That are, not compliant. You have to feed 6 people half a sa'a. Okay. However that works, find a local relief organization or contact your Hajj organizer, and they should be able to figure this out for you. Or if you want the more reward, slaughter a sheep, right? Or fast for 3 days. So I did want to clarify that because I did not want to leave you guys hanging on that really important note.
Thank you. That's great follow-up point there. So I'm just looking through some of these questions now, seeing what I can answer, seeing what's like more of a Naveed question, or anyone else, honestly, that wants to jump in. But so Asan asked about a bionic shoe. It's Rejuvenate Recovery Sandal. That one looked a lot more like the number 4 that we were looking at. I mean, if I'm honest. That's the one that Kamran. That one, I'd say, I mean, the whole heel looks covered there.
Yeah.
That one, and some of your lateral cuneiform is probably covered there. some of your tarsal bones are going to be covered with that one. Kamran, I don't know if you're here, if you're going to follow up afterward, but I'd say no to that one. The one that Asan shared, the bionic shoe, the recovery, that one really depends. I mean, it looks like number 4, but unless I really see it on someone's foot, it's hard to tell. Because again, if it's like past that midpoint of your foot, your metatarsals, right? If it crosses the base of your metatarsals, then you can't wear it. So that one's kind of like right at that cutoff. So I'd have to see it on someone's foot. If you want to like wear it and send a picture to Muslim Podiatry Network, I'm sure someone can get back to you. So yeah, that one's iffy, I'd say. Let's see. Faiza asked a question: what should I do if my foot is hurting near the toe top left area? Previously, I had an ankle strap, but it wasn't helping. The pain increased as I walked more. I mean, because you're a sister, I mean, you don't have to wear sandals, right? You don't have to wear an ankle strap. You can wear a shoe with a wide toe box. You can just wear something that just you feel comfortable in, that your toes can breathe in. If that's your complaint, you're having pain there, then I would just wear like a wider shoe, to be honest, and just walk comfortably. I mean, you have Allah subhanahu wa ta'ala, allowed you to do that. So just some comments here about marble. Yeah, marble is one of the best conductors of heat. Egyptians and South Asians follow the Hanafi fiqh. Yes, it's acceptable to wear shoes. I think those were the questions. I mean, does anyone have any other questions? No? Well, Jazakallah khairan, Naveed, for having me and letting me represent Muslim Podiatry Network and educating the community. This is exactly what our goals and our aims are, just to kind of talk about these important issues. And again, any questions about any of this stuff, just feel free to reach out to us or the Western Newark Dawah. It's this is just a great platform for everyone to kind of learn to get collectively in a safe space, I think. So Jazakallah khairan again. This is the honor to be here. So
no, thank you, Jazakallah khair, for sharing all this information.